In this research study, we're looking to try to understand what are the causes of autism. Autism right now is being defined mostly by a set of external behaviors that are not necessarily unique. But the issue is you can make a diagnosis of autism without understanding what actually is the biological cause. If we can understand the biological causes and/or contributions to autism spectrum disorders, this could lead to more personalized medical care approach. And what I mean by that is we can then target treatments to specific mechanisms, biological mechanisms that cause these problems, and/or the associated issues that they have and complications that they have. And this will eventually help families, it will help patients, it will help clinicians unlock the mysteries of autism and lead to better treatments, because then we can then target these treatments to biological mechanisms and not just to external symptoms. Right now with autism spectrum disorders, most clinicians try to suppress symptoms, and that can be a very effective approach as well. But if you don't really understand what's causing those symptoms, your treatments will never be as effective as they should be. If we can understand the causes and attack the causes rather than just the symptoms, then we can really develop better treatments in the long term. Individuals who participate will have a very extensive clinical evaluation. This will include an assessment of the electrical activity of their brain through an advanced technology that we have called dense array electroencephalography, or EEG. We will be measuring their sleep functioning by seeing how often they are awake and they're asleep over a number of days. And this will be done actually at home with a very simple device called an actigraphy that's very unobtrusive and painless. And in fact, all the studies that we're doing, except for a little bit of a blood draw, are painless. And in conjunction with one of our collaborators at St. Christopher's Hospital for Children, we will be looking at their energy production of what's called mitochondria. All that clinical information will be then compared to a genetic assessment that we're going to do. And for our genetic assessment, we're working with a collaborator in Massachusetts, Correlated Life Sciences. And we will be sending them a very small saliva sample. Well, they'll be able to extract DNA, or your genetic material, and they'll be looking at very specific genes that we're interested in. We'll be recruiting individuals between 6 years and 30 years of age who have a diagnosis of an autism spectrum disorder, and they will need to have either an associated problem of intellectual disability or epilepsy.